The occipital region of the human skull is particularly vulnerable to injury due to its anatomical and functional characteristics. This area, located at the back of the head, houses the occipital lobe of the brain, which is crucial for visual processing. Understanding the dangers associated with impacts to the occipital region requires an exploration of the structure of the skull and brain, the specific functions of the occipital lobe, and the potential consequences of trauma to this part of the head. The human skull is designed to protect the brain from injury. It is composed of several bones that form a rigid, protective casing around the brain. The occipital bone, located at the posterior part of the skull, is thick and robust, designed to shield the delicate tissues of the brain's occipital lobe. Despite this protection, the occipital region remains susceptible to injury from blunt force trauma, falls, or direct impacts due to its position and the nature of the forces involved in head injuries. The occipital lobe, located in the posterior part of the cerebral cortex, is primarily responsible for processing visual information. It receives and interprets input from the eyes, allowing for the perception of color, shape, movement, and depth. The primary visual cortex, or V1, located within the occipital lobe, is the first cortical area to process visual stimuli. Damage to this area can result in significant visual deficits, such as loss of vision, visual field cuts, or visual agnosia, where the ability to recognize objects is impaired despite intact eyesight. Trauma to the occipital region can result in a range of injuries, from mild concussions to severe brain damage. One common consequence of impact to this area is a concussion, a type of traumatic brain injury caused by a sudden jolt or blow to the head. Concussions can cause a temporary disruption of brain function, leading to symptoms such as headache, dizziness, confusion, and visual disturbances. Repeated concussions or a particularly severe concussion can have long-term effects, including chronic traumatic encephalopathy, or CTE, a degenerative brain condition associated with repeated head trauma. More severe impacts to the occipital region can lead to contusions or intracranial hemorrhages. A contusion is a bruise on the brain, caused by the brain striking the inside of the skull. This can occur when the head is subjected to a strong impact, causing the brain to move rapidly within the skull. Contusions can result in localized bleeding and swelling, which can further damage brain tissue and impair function. In the occipital lobe, this can manifest as significant visual deficits or complete loss of vision. Intracranial hemorrhages, or bleeding within the skull, are another serious consequence of trauma to the occipital region. There are several types of intracranial hemorrhages, including epidural, subdural, and subarachnoid hemorrhages. Each type of hemorrhage involves bleeding in different layers of the protective tissues surrounding the brain. Epidural hemorrhages occur between the skull and the dura mater, the outermost layer of the meninges. Subdural hemorrhages occur between the dura mater and the arachnoid mater, the middle layer of the meninges. Subarachnoid hemorrhages involve bleeding in the space between the arachnoid mater and the pia mater, the innermost layer of the meninges. Intracranial hemorrhages can lead to increased intracranial pressure, which can compress brain tissue and disrupt normal brain function. This is a life-threatening condition that requires immediate medical intervention to prevent permanent brain damage or death. In the occipital region, such hemorrhages can specifically impair visual processing and lead to significant neurological deficits. Another potential consequence of occipital trauma is diffuse axonal injury, or DAI, a type of traumatic brain injury that involves widespread damage to the brain's white matter. DAI occurs when the brain is subjected to rapid acceleration or deceleration forces, causing the axons, or nerve fibers, to stretch and tear. This can disrupt the communication between different parts of the brain, leading to a range of neurological impairments. In the occipital lobe, DAI can result in visual processing deficits, but it can also affect other cognitive functions depending on the extent and location of the axonal damage. The cerebellum, located just below the occipital lobe, can also be affected by trauma to the occipital region. The cerebellum is responsible for coordinating voluntary movements, balance, and posture. Injury to the cerebellum can result in ataxia, a condition characterized by a lack of muscle coordination, leading to difficulties with walking, speaking, and other motor activities. Because the occipital region is close to the cerebellum, impacts to this area can sometimes cause concurrent damage to both structures, compounding the neurological impairments. Another reason the occipital region is particularly vulnerable is due to its location at the back of the head, which is often exposed during falls or backward impacts. For instance, a person falling backward may strike the occipital region on a hard surface, leading to significant trauma. Similarly, rear-end vehicle collisions can cause a whiplash effect, where the head is rapidly thrown backward and forward, potentially causing damage to the occipital lobe and other parts of the brain. In addition to the immediate physical damage caused by trauma to the occipital region, there can be long-term psychological and cognitive effects. Individuals who suffer from visual impairments due to occipital lobe damage may experience difficulties with daily activities such as reading, driving, and recognizing faces. These challenges can lead to a decrease in quality of life and may require extensive rehabilitation and adaptive strategies to manage. Psychologically, the loss of vision or other sensory deficits can contribute to depression, anxiety, and social isolation. The brain's ability to adapt to such injuries, known as neuroplasticity, can vary significantly between individuals. Some may recover partial function over time with rehabilitation, while others may face permanent impairments. Understanding the full impact of occipital trauma requires a multidisciplinary approach involving neurologists, ophthalmologists, psychologists, and rehabilitation specialists. Preventative measures are crucial in reducing the risk of occipital injuries. Wearing protective headgear, such as helmets, can provide significant protection in activities that pose a high risk of head injury, such as cycling, contact sports, and certain occupations. Additionally, implementing safety measures in homes and workplaces, such as using non-slip mats and installing handrails, can help prevent falls that might result in occipital trauma. In the context of sports and recreational activities, education about the risks of head injuries and the importance of protective equipment is essential. Coaches, trainers, and athletes should be trained to recognize the signs of concussion and other head injuries and to take appropriate actions, such as removing an injured player from the field and seeking medical evaluation. The medical community continues to research and develop new technologies and treatments to better understand and manage head injuries. Advances in neuroimaging techniques, such as MRI and CT scans, allow for more precise diagnosis and monitoring of brain injuries. Additionally, research into neuroprotective treatments and rehabilitation strategies aims to improve outcomes for individuals who suffer from traumatic brain injuries. In conclusion, the occipital region of the skull is particularly dangerous to impact due to its anatomical and functional significance. The occipital lobe, responsible for visual processing, is crucial for interpreting and responding to visual stimuli. Trauma to this region can result in a range of injuries, from mild concussions to severe brain damage, including contusions, intracranial hemorrhages, and diffuse axonal injury. The consequences of such injuries can include significant visual deficits, motor coordination problems, and long-term psychological and cognitive effects. Understanding the risks associated with occipital trauma and implementing preventative measures are essential for reducing the incidence and severity of these injuries. Advances in medical research and technology continue to enhance our ability to diagnose, treat, and rehabilitate individuals affected by occipital region injuries, improving their quality of life and overall outcomes.